let's understand about the most scientifically researched supplement, creatine. 95% of creatine is stored in the muscles. 5% is stored in liver, kidney, brain, testicles. Our body can produce 1 to 2 grams creatine in liver and kidneys based on the protein intake. Creatine provides us with energy. It recycles ATP, main energy currency of our body and cells. Each cell can store ATP in small amounts. Protein, fats, sugars are all metabolized to make creatine. Why our body requires creatine. Brain requires creatine to fire its signals. Eyes requires creatine for vision to pass through the eyes and fall on retina, to process images and lighting speed. Ears, GI tract, gut, testicles, movement of sperms. Muscles ATP lasts for about 8-15 seconds, and thereafter is generated by fats, protein, glycogen. Storage can increase, but our body cannot store above 160 grams of creatine. Height, protein intake, and exercise matters how much creatine body produces. Food sources, grams per kilograms. Cod, 3 grams, herring, 6.4 to 10 grams, salmon, 4.5 gram, tuna, 4 grams, pork, 5 grams, chicken, 5 grams, red meat, 8 grams. Dosage. There are 2 phases, loading and maintenance phase. Loading phase, 0.3 grams per kilogram per day of creatine monohydrate. Depending on body weight, dosages are divided into 3 to 4 daily equal doses for 5 to 7 days. Then, take 5 grams per day to maintain elevated creatine stores. Maintenance phase. Take 3 grams per day for 28 days. However, it is less clear whether this low-dose protocol enhances exercise capacity. Keep in mind, before loading phase, increase water intake 1 to 2 weeks prior to it, as there are chances of getting dehydrated. Ingesting creatine with carb or protein has been reported to enhance muscle creatine uptake. Timing. If the primary mechanism by which exercise induces an increased creatine loading of muscle is via an exercise-stimulated increase in blood flow to the working muscles, then pre-exercise creatine supplementation would be expected to be the most effective supplementation strategy, compared to supplementation intra or post-workout or at any other moment of the day. Benefits of creatine. Athletic and exercise performance improvement. It increases muscle power by 20 to 26%. As it increases our creatine stores and therefore increases our exercise potential, power, and performance. Post-workout recovery, injury prevention, thermoregulation, regulation of heat, rehabilitation after an injury surgery, protection to spine, spinal cord neuroprotection, concussions, delays aging, it inhibits sarcopenia, muscle atrophy. As you age, your muscles become thinner. It inhibits muscle thinning in old people. Creatine with exercise can increase bone density. Vegetarians will experience much better results, as their creatine stores see a significant increase. Risks and precautions. 3 to 5 grams can be safely taken daily. Above 5 gm can cause stomach upset, nausea, gas, bloating. It can be divided into 2 doses of 2.5 grams. If you have a kidney disease, or taking any drugs like antibiotics or nephrotoxic drugs or painkillers, don't take creatine with them. Don't consume creatine with coffee. Because coffee makes you lose water, diuretic effects, chances of getting dehydrated increases. Although there are different forms of creatine, like creatine ethyl ester, creatine hydrochloride, buffered creatine, liquid creatine, creatine magnesium chelate. Creatine monohydrate is the best form, has the best safety record, and heavily researched. Creatine is a natural substance in our body and in protein-rich foods. You can take creatine as a supplement. It is safe, proven, evidence-based, most researched supplement.